What are the common types of B-cell lymphoma? Imagine your immune system as a busy city with many different workers. B-cells are like the city's defenders, fighting off infections. Sometimes, these B-cells can grow uncontrollably, leading to a group of cancers called B-cell lymphomas. These are the most common type of non-Hodgkin lymphomas, making up about 85% of cases. Understanding the different types helps doctors decide the best way to treat and manage these conditions. The most common type is diffuse large B-cell lymphoma, or DLBCL. This is an aggressive lymphoma that often appears as a rapidly enlarging lump in the lymph nodes. It can also develop in other organs. DLBCL has several subtypes based on genetic features. One subtype, called germinal center B-cell-like, tends to respond better to treatment and has a more favorable outlook. Another, called activated B-cell-like, is less responsive, but recent advances have improved outcomes. There is also a type that doesn't fit neatly into these categories, called unclassifiable. DLBCL can sometimes involve specific areas like the brain or skin, which influences treatment choices. Follicular lymphoma is another common type. It tends to grow slowly and usually presents as painless swelling of lymph nodes. It originates from germinal center B cells in the lymph nodes. While it often progresses slowly, it can transform into a more aggressive lymphoma over time, requiring different treatment approaches. Chronic lymphocytic leukemia and small lymphocytic lymphoma are closely related. They involve mature B cells and are generally slow-growing. Chronic lymphocytic leukemia affects the blood and bone marrow, while small lymphocytic lymphoma appears mainly in lymph nodes. Despite their different names, they are considered different manifestations of the same disease. Mantle cell lymphoma is less common but more aggressive. It starts from B cells in the mantle zone of lymph nodes and often involves the lymph nodes, spleen, and sometimes the gastrointestinal tract. It can be challenging to treat but responds to specific therapies. Marginal zone lymphomas are a group of slow-growing cancers that develop from B cells in the marginal zone of lymphoid tissue. They include extranodal marginal zone lymphoma, also called MALT lymphoma, which often occurs in the stomach but can appear elsewhere. Nodal marginal zone lymphoma affects lymph nodes, and splenic marginal zone lymphoma involves the spleen. Burkitt lymphoma is a highly aggressive form that grows very quickly. It is often linked to infections like the Epstein-Barr virus and involves rapid cell division. Because of its fast growth, early diagnosis and treatment are crucial. Lymphoplasmacytic lymphoma, also known as Waldenstrom macroglobulinemia, is a rare slow-growing lymphoma. It involves B cells that produce large amounts of a protein called IgM, which can cause blood to become thicker and lead to symptoms like vision problems or bleeding. Hairy cell leukemia is a rare, slow-growing disease where B cells have hair-like projections under the microscope. It can cause symptoms like infections or low blood counts but responds well to specific treatments. Primary central nervous system lymphoma is a type that starts in the brain, spinal cord, or eye. It is a rare form that requires specialized treatment because of its location. Similarly, primary intraocular lymphoma affects the eye and is often considered a subtype of central nervous system lymphoma. Each of these B-cell lymphoma types has unique features, behaviors, and treatment options. Accurate diagnosis involves tests like microscopic examination, genetic analysis, and molecular profiling. Because each person's situation is different, treatment plans are personalized based on the specific type, stage, and overall health. If you or someone you know is dealing with lymphoma, it's essential to consult healthcare professionals who specialize in blood cancers. They can provide the most current, evidence-based care tailored to individual needs.